Hello, this is Dr. Joanne Manson, Professor of Medicine at Harvard Medical School and Brigham and Women's Hospital. I'd like to talk with you about a recent report in circulation from the American Heart Association and AHA scientific statement on the menopause transition and cardiovascular disease risk, implications for timing of early prevention. As we all know, heart disease is the leading cause of death in women, yet only about half of women are aware of this fact. The menopause transition or period beginning about 2 years before the final menstrual period is a stage of life in which there's accelerated cardiovascular disease risk and adverse changes in cardiovascular disease risk factors. And the purpose of this report is to highlight that this is a window of opportunity for helping women to reduce their risk factors and also to lower cardiovascular disease risk. I'd like to acknowledge that I'm a co-author of this report. There are several cohort studies, longitudinal studies that have looked at the role of the menopause transition as well as the entire perimenopause, which also includes about 1 year after the final menstrual period. This is a stage in life when estrogen levels, although fluctuating, are substantially declining and FSH levels are increasing. And they've tried to disentangle in these cohorts what changes in risk factors are due primarily to ovarian aging as opposed to chronological aging. And they've identified some of the risk factors linked to ovarian aging as including the increase in LDL cholesterol, increase in apolipoprotein B, changes in the quality of HDL, where HDL may really not be protective, changes in its function. Also, changes in body composition, such as increase central and visceral adiposity, and also some ectopic fat distribution, including pericardial fat, as well as a reduction in lean body mass and an increased prevalence of metabolic syndrome, although some of the risk factors are more closely linked to chronological aging, such as changes in blood pressure and glucose tolerance. Now, we know that during this period of time, especially in women who have premature menopause, menopause onset before age 40, or early menopause between the ages of 40 and 45, where there can be particularly high risk of cardiovascular disease. The report does discuss and address the appropriate use of estrogen, which may be a particular relevance in women who have premature early menopause, but also among women who have significant vasomotor symptoms or other menopausal symptoms, especially those interfering with sleep and disrupting quality of life and sleep quality. Most importantly, this report is really focusing on the importance of lifestyle modifications, physical activity, heart-healthy diet, the Life Simple 7, and the tremendously important role that lifestyle modifications can have in lowering women's cardiovascular disease risk, improving risk factor status during this period, as well as, in some cases, pharmacologic management of the elevations in blood pressure or lipids. Now, although we need much more research on the relationship between the menopause transition and cardiovascular disease risk in women, there already is a critical mass of actionable information that can be used to help women to improve their cardiovascular disease risk factor status, especially during this period of accelerated risk, and ultimately lower their risk of cardiovascular disease. Thank you so much for your attention. This is Joanne Manson.